So my plan today is to talk, the learning objectives that I have is, to identify risk factors, right? So every youth has risk and protective factors. So what points put a youth at particularly higher risk for substance use and substance abuse? We'll talk about indicators. We'll talk about ways to increase protective factors. We'll talk about intervention. I'll share some of the trends that I see and that I'm seeing more recently, and kind of what you guys can maybe look out for. And then, like I said, I'll make sure to share some local resources. So if you are identifying youth, making sure that I'm providing you information to connect them. Just for the purpose of my PowerPoints, I do reference parents frequently throughout the slide, but I do want to just make sure that I also state that this is inclusive of other caregivers as well. So I know a lot of times our kids are raised by like grandparents or aunts and uncles, or they're in a foster home. So when I say parents, what I really mean is, and what I'm implying is really any caregiver that's taking care of our youth. So, all right, so we'll go ahead and get started. So before we get started, while we're on the topic of language, I do want to just kind of say it. So when I was requested to give this presentation, it was regarding addiction services and youth addiction. And what I typically do and what I would encourage you all to walk away with today is if you are talking to a youth or family about addiction or substance, I would use the word substance use. A lot of times what I see is if I use, because I think we all know what we mean when we say addiction, right? We're talking about substance use, abusing drugs and alcohol, right? A lot of times our youth and parents, they just don't see their kid in that category. Sometimes addiction, it implies like a physiological dependence. And for most of our youth, that really doesn't apply to them. They typically haven't been using long enough or frequently enough to develop a physiological dependence. Some can. I'm not saying that no youth might fall in that category, but for most, they don't. And so I always use the word substance use, or I'll mention a particular drug or alcohol specifically, just because sometimes you might get a more accurate answer, if that makes sense. And like I said, and diagnostic term is a substance use disorder. So when I talk to youth and they do make criteria for a substance use disorder, I use that language as well. Many youth, when they come in and I see them, they're very clear that they are not an addict, this, that, and the other, right? But when I say, well, you meet criteria for like a cannabis use disorder, it kind of feels a little bit more clinical. And to them, it feels, it's just, they can relate to that a little bit better when you use that kind of language. So right off the bat, so just talking about some risk factors. So there are a lot of different things that can put a youth at risk for substance use disorders. And just so you know, and I apologize that my references didn't attach to my slides. I put them in my notes, but I think you guys were all sent a PDF version. So these risk factors were actually pulled from the CDC website. So these are just some of the heavy hitters, right? And so there's a lot of different factors that can that can put a youth at risk of substance use disorder. And to some degree, all youth are at risk for a substance use and substance abuse, right? But some of the heavy hitting ones are low academic achievement, childhood sexual abuse, having some sort of family history, whether a parent be actively using or in recovery, mental health diagnoses, favorable attitudes towards substance use, monitoring and supervision gaps, family rejection of sexual orientation or identity, affiliation with peers who also engage in substance use. And I think that one's definitely one we see a lot, right? Kids who are using drugs and alcohol are more than likely hanging out with kids who are also using drugs and alcohol as well. And then lacking, connection with the school. And I'm going to talk about some of these a little bit more as well. Before I move on, we'll kind of touch on a lot of these, but do you guys feel that there's anything missing from this list? Like I said, those are kind of the heavy hitting ones, but is there anything that you're surprised about? Something that you feel that should be represented on?
About, and this might be in mental health, but trauma survivor.
Absolutely. Yes. And I know child sexual abuse is included, but absolutely any kind of trauma is definitely can definitely put a youth at
recent or acute stress.
Yes. So, and I know there's monitoring and supervision represented when we talk about, and I like that you say like recent or acute stress. So family conflict is actually a significant contributor to youth leaving without the permission. So when they're out for long periods of time, and Dr. Cross Hillman this will sound pretty familiar, but we always talk about there's push and pull factors when kids are leaving home without permission, right? Something outside of the home that's pulling them out of the home, right? But then there's also something going on within the home, such as like family conflict or domestic violence or something going on within the home that's kind of driving that youth to leave as well.
In the chat, somebody added poor parenting.
Yeah. And so, I'm going to kind of reframe that a little bit as well, right? So part of what I do is, family engagement is something that I touch on a lot. And a lot of times what I see is family skill level, not knowing how to recognize like intoxication or not picking up on some of those risk factors or signs of substance use, but then also not knowing how to intervene, right? Again, this might be something a lot of times, we tend to assume like poverty, it puts a youth at higher risk for substance use. And to some degree that is true, right? Like socioeconomic status plays a role in a lot of different behaviors, but it's not as strong of a contributor as some people might think. And so when we talk about, and really what there's some correlation, but really, like we all know, that doesn't equal causation, right? And so it's not as strong of a contributor as we might think. Sometimes what happens is if, youth are growing up in in a neighborhood with a lower socioeconomic status, there might be a higher availability of drugs in that neighborhood, but that doesn't necessarily mean that their low income status is putting them at higher risk for substance use than someone who might be coming from a middle class or upper class family. So I have definitely, in my experience, I have seen all walks of life. And so it doesn't always matter where you come from. This is, when substance use is something that individual risk factors that we kind of talked about. So we talked about that, affiliation with peers that are also using, and that is absolutely true. If I had to pick like the biggest correlation on that list, I would say if kids are hanging out with friends that are also using drugs and alcohol, they're probably using as well. But I think sometimes it's also something that's also missed is when kids are hanging out with like those more antisocial peers, kind of, who are using drugs and alcohol, a lot of times they've experienced rejection from more pro-social peers. And I think that's something that's often missed. A lot of the kids that I work with in the substance use world, and mental health too, is they lack these social skills, right? And we were just talking about COVID and this like social anxiety, right? A lot of times these kids have missed opportunities to learn appropriate social skills. And so then they experience rejection from their pro-social peers, right? And so, but who can relate to them? People who also maybe struggle with social skills or have that their peers that are considered more delinquent might be more accepting of some of these quirks that they have. Sometimes these, they come from families where parents also might might lack these social skills as well, or parents are just not teaching them. And a lot of the kids that we work with are highly impulsive, and then they're also kind of concrete thinkers, right? So what I find is when I'm teaching some of these kids social skills is you really have to be so clear in what you're doing. So I'll point out like, hey, do you realize how close you're standing next to me? Or, when I'm talking to you, can you please make eye contact with me? Or when we teach social skills, I have to be a little bit more clear and specific with kids that might meet criteria for a substance use disorder, because they do lack some of those social skills that some of our other kids might have already. And there is some evidence to support that, like 25% of the kids that meet criteria for substance use disorder also meet criteria for ADHD. And what I see a lot of times, and especially with families that have a family history of addiction. So if I'm meeting with a parent, they might have a grandparent that had a history of like problematic alcohol use or something along those lines, or they might have a family history of meth use. Sometimes these parents are very fearful of treating an ADHD diagnosis with a stimulant medication, in fear of that this kid would develop a substance use disorder later on. They kind of feel like you're opening the gate up a little bit. And really what research has shown is when, ADHD is appropriately identified, diagnosed, and treated, it actually reduces that risk of future substance abuse. And so a lot of times we do have to provide some education to parents on that, because they're well intentioned, right? I mean, they're doing what they feel is best, and they're doing what they can to try to prevent future substance abuse. But really, the research is kind of showing a little bit different. And one thing that I see personally, is a lot of times I meet with kids and they might have an unidentified learning disability. So sometimes they might struggle, when they have this lack of school connection, they might have some difficulties with like reading comprehension or, things like that. And so then they're asked to do these various activities in schools. But then when we also have these social skill deficits, they're also not able to communicate in a way that's appropriate as well. So sometimes these kids will kind of come off as standoffish, and they might refuse activities and things like that in school. And so then these learning disabilities are really never identified. And so those are some of the things. I'll link up on some of the family and school risk factors. So family is absolutely a player in youth risk factors, right? So I know somebody mentioned parenting. Attitude is definitely something that I see a lot. Sometimes parents don't realize the message that they send by not making their rules and expectations very clear with youth and with their kids. Sometimes they have this perception that, well, the kids should just know better. They should just know better, right? Well, they don't know better if they're not taught either. And so sometimes parents, they have they expect a little bit more of their kids than their child is able to do, right? So it might be developmentally appropriate to just expect a 16-year-old to know the rules of the house, right? For most kids, but sometimes some of our youth are a little bit more, their emotional maturity is a little bit delayed, right? And so with that, we have to kind of meet that kid where they're at and catch them up versus just having this blanket expectation across all 16-year-olds, right? And so, and again, sometimes our youth are concrete thinkers, right? So if you're not spelling it out in black and white, they're not really understanding. Or you have sometimes those kids that are they're choosing not to understand, right? My favorite line in the world is, well, nobody ever told me. Nobody ever told me. It's always my favorite. I'm sure no parent of teenagers has ever heard that, right? And then, when we talk about attitude as well, sometimes parents have this like do as I say, not as I do kind of mentality as well. And so I see that a lot. They might tell their kid, well, absolutely none, but and which is great. I fully support parents that set an expectation of no drug or alcohol use, but then also might model inappropriate drug and alcohol use as well, or might be actively using in the home. As far as monitoring and supervision, so this is something that I find a lot as well, is that parents, there's just not enough follow-up on their kids' whereabouts. And so, as far as monitoring and supervision, I want parents to be asking about, I want them to know their kids' friends, I want them to know their friends' parents, using adult to adult exchanges, right? Kind of getting to know who is in your kids' circle. And I know that seems kind of obvious, but for some of our parents, it's not. And so these, I'm sure we've got plenty of people in here that have parented teenagers or are actively parenting teenagers, right? And so, a lot of times we spend that time getting to know our kids' friends and their friends' parents. And this is also something that we use to identify potential active use, right? Is your kid hiding their friends, right? Are they not bringing them around the house? Because if they're not, there's probably a reason why. And so as far as monitoring and supervision as well, sometimes what I see a lot as well is parents might be working long hours, working odd hours, working 2 jobs. It's a single parent household, things like that. And so that might contribute to some of the monitoring and supervision issues. But what I find a lot is they're not actively using like other friends and family to assist with the monitoring and supervision needs as well. And, as far as, sometimes our families don't always value or encourage pro-social activities. Pro-social activities can kind of play two different roles, right? So one, it connects kids to pro-social peers, right? So kids that are also, hopefully not using drugs and alcohol, right? There's an expectation, especially through schools and school sports, that you maintain a sobriety status, right? And so schools and pro-social activities can actively reinforce that, but it also provides another level of monitoring and supervision as well. And I'm just realizing the time, so I'm going to kind of move through some of this a little bit quicker, just so we can make sure we get through everything as well, because I know we have to do a case study as well. And then, some school factors, like I said, we kind of talked about kids not being, having undiagnosed learning disabilities, and not being on IEPs and receiving that support that they might need. Sometimes these acting out behaviors might have them labeled as like a bad kid versus somebody who's really just not understanding what's expected of them. Some protective factors, so family engagement and support, so parents who are like highly involved in the kids' life, again, kind of getting to know everything around them, people around them, and really knowing that circle. These are also pulled from the CDC as well, just so you guys know, Center for Disease Control. Again, parent disapproval of substance use, making it very clear what the expectations are, high level of monitoring and supervision, knowing where your kid is at, who's around them, who they're spending time with, and then that school connecting. So things to reduce risk. So again, encourage parents to model healthy behaviors. So if you're trying to treat a substance use disorder, you should definitely be working with a parent as well, right? So what are they doing? How do you model that? And how do they learn these various skills to kind of help with that intervention? Fostering healthy relationships through conversation and pro-social activities. Again, if nothing else, connecting that kid to a pro-social activity and pro-social peers is, that is the first thing that's always my go-to move if I had to pick one thing to do. Know your child's friends and their parents. Again, this is also if a parent is suspecting drug and alcohol use, if they already have that established relationship with a friend and their friend's parents, it's a nice way to kind of say like, hey, Johnny's acting a little strange. Is Blake also, or what's going on? Have you seen anything? Like, it's a way to share information and also know what their group of friends is doing. And then setting clear rules and maintaining a safe home. And so I'm going to follow up on maintaining a safe home as well, because, most kids are not obtaining drugs and alcohol from their home. However, sometimes there are available substances, right? So if a parent is on like an opioid pain medication, or even just having over the counters around the house, it does provide some access for that youth to abuse those substances. So so what I always kind of do, what I talk to parents about is, plan A is getting it out, eliminating that access. So one thing that I give parents frequently, I don't know if you guys have ever seen doTERRA bags. I don't know if you can see them. I just get these through FargoCast Public Health. I give them to families all the time. They give them to me for free. And so that's something I use for safe medication disposal. It deactivates the chemical properties of medication so that parents can throw them away right away. Sometimes what I've had to do in the past before I had these is have parents lock them up, and then you're waiting around for garbage day, because if you think a kid is not going to dig through a garbage to obtain medication that they can abuse, you're wrong. They will. I've seen it. So plan B is to lock it up. So if it's something you have to keep in your home, at least eliminating that access to that drug. And I always say 2 locks are better than 1. So if you can lock it in a lockbox in a locked room, that's great. And plan C is to reduce quantity. And what I mean by that is just, I always tell parents, like, make it so you would notice that it's gone. And knowing the signs, and this one's a little tough, bottom line, what it comes down to is if you had to do one thing, pay attention to those behavioral changes. So if your kid is doing anything differently now than they used to, pay attention to those. And then also take time, when your kid is out, when they come home, make it a point to interact with them so you can kind of monitor for signs of intoxication, right? Do I have any questions so far? It's a really quiet group. I can talk all day. I just want to make sure. Do we have any questions from anybody in the audience? Okay. One thing I also talk to parents about as well is when we talk about monitoring and supervision, another way to kind of pick up on potential signs of substance abuse is to go through your kids' room. And, if a kid is actually purchasing their own supply, they have to keep it somewhere, right? And so kind of going through their rooms, I always say, make it a point to just at least be in the room once a day. If you can do a search, I'm all about it. But at least make it a point to be in that youth's room at least once a day or wherever they might spend time, right? So if they're actually purchasing something, they got to keep it. So hopefully you can find it. And kids are not sneaky. I mean, they think they are, but they are really not. And so you might not catch it right away, but eventually you will. And then also, monitor their phones. I mean, there's lots of phone monitoring apps that you can use. I honestly say the best way to go about doing that is to just physically go through their phone. Sometimes what I see is parents try to protect that youth's privacy, sometimes at the expense of that monitoring and supervision piece, right? And so that's something I definitely encourage parents to do. And so this slide is just my own experience, right? And so this is not anything that I'm finding through like research or anything like that, but this is something that I personally am seeing and what my colleagues are seeing, at least recently. I've definitely, especially with youth, I'm seeing an increase in use of marijuana wax, oils, and edibles. So, one kid I was working with recently, she was telling me that she uses edibles because she can use in her room. She keeps it under the bed, and her mom's not going to smell it. And so things like that are what I'm seeing a lot. The waxes and oils, they have a higher concentration of THC as well. And so, and for whatever reason, they're really just kind of seen as healthier is not as bad, or so that's one thing that I'm seeing with kids a lot. But they're very concentrated, and they definitely impact youth in a very different way. I'm seeing a lot of kids, a lot of our kids, again, coming out of a pandemic, I'm definitely seeing a lot more anxiety-like symptoms in kids, but these highly concentrated substances, I'm definitely seeing them exacerbate some of those symptoms as well. So did you have something to say, Jen? Oh, can you hear me?
When you go into a child's room to inspect, how do you respond to the question when they say, when you do this, it makes me feel like you don't trust me. What have I done so that you don't trust me?
Well, and so here's the thing. So it to some degree, you are betraying that kid's trust, right? So by going through their room, and yeah, it is. I can see why a youth would feel that way, but also I have a duty to protect you from things that might hurt you, right? And so it's not, I trust you to a certain degree, but I also have a duty to protect you from things that could potentially hurt you as well. And this is what I found. I do also find that, and I encourage parents to establish that expectation before they do that as well. And so I know that might seem like it's giving an opportunity to hide something as well, but you don't have to say when, right? So just saying, I am going to be going through your room at some point, right? And so, and kid might dispose of what they have. And if that's the case, great, it's gone, so either way, you kind of get what you want. So having those conversations up front and saying the why behind this is also helpful as well. You should not be in the room when you go through it. They don't need to know your tricks that they're keeping up your sleeve as well. But, and then also making sure that you follow up with a conversation with that youth as well. So it is a betrayal of trust to some degree, but again, I always tell parents we can't sacrifice privacy at the expense of that monitoring and supervision and protection, really.
Thank you.
Yeah, absolutely. Thank you for letting me know that we had a question. One thing I'm also seeing, and this seems to have been kind of a shift. So, several years ago, I would see more regular like alcohol use with occasional marijuana use sprinkled in, but now I'm kind of seeing it flip-flop. So I'm seeing more regular use of marijuana with occasional alcohol use. And so, again, marijuana is perceived as better than alcohol. It's not as bad for you. It doesn't have as many long-term consequences. Again, when we're talking about those waxes and oils, I would definitely argue that I'm seeing that really impact youth who already have potentially like a budding mental health condition as well. I'm also seeing a lot of really heavy use in vaping products. And a lot of times I'm seeing kids, they just completely lack education. They don't realize how much they're actually using as far as vaping products. And, you know, I think we're all well aware if you use enough nicotine, you can definitely kind of produce a high from it. So, you know, these kids, and now the thing is they're purchasing a lot of the disposable vape pens. So it might be like a 1600 puff pen. But what kids don't realize is that each of the, you know, each puff you take is the equivalent of one cigarette. And so these kids are going through these in a matter of days. And so a lot of times what I'm seeing is they don't realize they're smoking the equivalent of like 2 to 2.5 packs a day. And they just don't realize that. I'm seeing more higher risk substance use in rural regions. So I'm seeing it, and again, this is not the norm, right? So I don't see a ton of this, but I am seeing more of it than I used to. Use of like opioids and fentanyl, which, you know, it's, you know, being manufactured, you know, on the street and in China and shipped in. And so kids are I'm seeing more fentanyl use with kids and meth. I'm also seeing a little bit more IV drug use. And so I am seeing more of it. Again, I don't see a ton of it, but I see it a little bit more in rural, like some of those more rural areas. One thing that I'm seeing a lot more of now as well, and I don't know if any of you have come across this, but kratom extract. So kratom extract is sold in like those smoke shops. And so it's not illegal, so they can sell it in these smoke shops. So they've been a little bit more popular on college campuses. And so usually what I see is as things kind of increase in popularity in college campuses, it tends to trickle down to kind of be the younger youth. And if you're not familiar with it, so kratom extract, at lower doses, it acts a little bit more like a stimulant. It's, you know, intended to kind of help increase focus and things like that, but it has some pain relieving qualities. So then at higher doses, it acts more like an opioid. And so there's not a ton of information out there. So a lot of what I've gathered is really just kind of through like some Google searches and asking a lot of clients, but that's really what I'm gathering so far. And so I'm seeing a lot more of that. I do see some over the counters, like those, you know, it's not super common, but, you know, kids will sometimes abuse like that Unisom and Tylenol PM. So I see some of that. Those are more like occasional. You don't see a lot of kids that are using that heavily and all the time. Every once in a while you do, but again, marijuana is really kind of our heavy hitting drug right now. And I know someone mentioned in the email, it was mentioned like hallucinogens were mentioned. When I see a kid using hallucinogens, typically that's more of like a crime of opportunity. With kids and adults both, it kind of seems like when it becomes available, it's like if it happens to be at a party or if it just happens to be available, they'll use it. But it's not typically something that kids seek out on a regular basis. So if I'm doing like an evaluation with a youth, they'll typically tell me they've used it a couple of times over like a couple of years span. So it's not, you know, there's always that case, there's always that exception where they are using it a little bit more regularly, but for the most part, it's typically pretty, it's infrequent. And then every once in a while, I'll see like, it seems like inhalants use, it'll kind of be like a fad and then it kind of goes away. So that kind of comes and goes. Sometimes there'll be a period of time where you see it a lot and then it kind of fades out. And then it kind of comes back. So right now I'm not seeing a ton of it, but that doesn't necessarily mean we won't see it in the future as well. I'm curious, are there any trends that you're seeing that maybe I'm missing that aren't included?
You can go ahead and put it in the chat or unmute yourself once again. I think in previous echoes, we have talked about what had been happening kind of in the Grand Forks area where they had seen an increased use of LSD and some mushrooms without actually using as many opiates. Seeing that trend had kind of gone down and those other two substances have made some increase in popularity in that area.
Oh, that's interesting. Okay. So you're seeing more of the like the LSD and hallucinogens in Grand Forks. Okay. Interesting. Okay.
That was a
Okay.
comment made in the chats at that point. Other concerns around substances were parents, and this is always a something of the season as well, right? So graduation has happened, people making the exceptions to, you can drink at our home, you cannot drive, so you need to leave the keys. And then parents who have given their child marijuana or alcohol, and they're telling their primary care provider about it, but they've done so because of behavioral concerns at younger ages, to get them to calm down, to get them to sleep, to do some other things. But
Okay. And so sometimes what I run into with parents is, so if parents are supplying their youth, their son or daughter with drugs or alcohol, that does fall under the category of like a 960. And so we all are mandated reporters here. And if you are seeing that, I would definitely, you definitely want to maybe explore possibly reporting that. If that is absolutely something that I would do if it were somebody I were working with. And so, yeah, it's hard, because, again, we are in graduation season, and also, I'm in Fargo, right? And I'm an NDSU alum. And so I go to Bison tailgating and I walk around, and, if I were to say that all parents are completely well-behaved and not engaging in binge drinking, I think we all know that I would be lying, right? And so it's not as easy, again, sometimes we do some of those mixed signals, right? So we're saying, no, you need to engage in appropriate drug and alcohol use, but here I'm gonna go tailgating. Just look the other way, right? And sometimes, unintentionally, parents, send those messages as well.
in the chat conversation about, I suppose it's the retort of the discussion of legalizing marijuana, and any plans to respond to that.
Yeah, that's been a topic of conversation with LAC, with addiction counselors, for a long time. What I see typically is it's kind of a mixed bag as far as like the professionals go. And, because on one hand, some professionals see it as, well, alcohol is legal and people abuse that too. Right. Just because something is legal doesn't necessarily mean that it reduces the risk for,
Recommendations for parents who are talking to 18-year-old kids to.
Because again, this week in clinic, one of my graduates is going to Europe, where the drinking age is 18. And parents have consistently, and we've talked in the clinic about the brain develops until age 25. So if we're going to make laws now, we would not have legalization at 21, it'd be 25.
Oh, absolutely.
But so the kid is going, well, but it's legal here and at 18.
Yeah.
And so what are I have crafty patients. So what are your recommendations for managing that?
Who's paying for the trip?
Yeah, that's good motivator. Okay.
Yeah. And so that's what I would say, just because something is legal doesn't mean it's okay, right? There's lots of things that are on the market that maybe aren't okay or a little bit questionable, right? And so that's what I would ask that parent, is if the parent is not wanting that kid to engage in alcohol use, and they're paying for the trip, they absolutely have, full authority to set that expectation as well. And you're right. I mean, one of the best things you can do to prevent future substance abuse is delaying onset and to delay that start, right? Your brain is developing until you're 25, 26 years old. That prefrontal cortex is not there, is not fully developed yet. And so the later kids start using drugs and alcohol, the better, less likely they are to abuse those substances in the future. And so I'm with you. So just to respect time. So when do you refer to treatment? I know that's always that's always the big question, right? So when do we refer to treatment? And that's hard because there are a lot of risks and benefits to treatment. I will say it never hurts to get an evaluation. If you're wondering if a kid is at risk for further substance abuse and you're not really sure if they'd be appropriate for treatment, you can always refer them to an evaluation. But just like any intervention we do, there are always risks and benefits. And so, some things that maybe would be happening that might be for the sake of time, I'll just kind of move on, but here's the bullets indicate some things that might be happening that might say that a kid would be appropriate for a treatment referral. And treatment can range anywhere from like an hour a week up to like a residential intervention, right? Or there could be just education, things like that can be provided. So treatment can look very different for different kids and depending on what their needs are. And it should be matched to what their needs are. And it should always be at the least restrictive environment possible. I will say in North Dakota, across the state, even in Fargo, there are significant level of care gaps. And so just because a youth might meet criteria for like an intensive outpatient, but that level of care may not be available. And so what happens a lot of times is then we're having to figure out what is the more appropriate recommendation. Do you bump them up a level of care or bump them down? And typically I always say bump them down a level of care. But sometimes LAC's addiction counselors may be conservative about their treatment recommendations because if you put a youth in a group therapy setting, you could be putting them at risk of at greater risk for furthering their substance abuse, right? I've seen it several times where youth are referred to a level of care and then they actually kind of increase some of their connections with peers. And because we have these level of care gaps, sometimes they're put in a higher level of care and then these problems happen, right? So sometimes recommendations are made conservatively. And sometimes families get a little bit upset about that. So I will just kind of say you may see that at times because that's just what's happening across the state. Even in Fargo, one of our facilities just is in the process of closing. And so that's creating another level of care gap even within Fargo. As far as legal charges go, so if a kid is getting any legal charges, they may be referred to treatment by the legal system as well. In North Dakota, we're undergoing like a pretty significant juvenile justice reform where they are more focused on like rehabilitation and connecting to treatment versus incarceration, right? Because if it's a behavioral health issue, it should be treated by behavioral health. So that is happening in our system as well. Some helpful resources. So some of my slides, my information was pulled from Parents Lead. I use this resource a lot. It has a lot of really good information on how parents can prevent substance use and substance abuse. I refer parents there a lot. First Link, if you're looking to make a referral for treatment, they have a database on their website, where you can kind of find providers, things like that for various needs. So parents can also call 211, and this is how they would access the crisis line after hours as well. Regional Human Service Centers are a great resource. If you're looking for a local resource in your community, they typically have a better pulse on what's going on in their region. And then the Addiction Technology Transfer Center network, as Kim had mentioned, there's a series on cannabis use. They also have a ton of different webinars. I've used them frequently as well. I've referred some of my colleagues on to that website for various resources like treating psychotic disorders, with a co-occurring substance use disorder. They do also have a nice series on prevention as well. So definitely use that. It's a really
particular screener that, really encapsulates multiple drug potential usages. I know there's many of them out there, right? So there's the craft N. If you're looking at an SBIRT process in a clinic setting, do you have any that you like to use or that you would recommend using?
I don't use a lot of screeners. What I do is I actually just kind of assess. Alrighty, I did bring a case study. And so it's kind of blocking my screen. So I will go ahead. And again, if you guys have any follow-up questions, feel free to reach out to me. I did include my contact information, or if you have any feedback for me, or if there's anything that I can follow up on, or if you're having a hard time accessing resources, I'm definitely happy to answer any questions you all may have. So like I said, feel free to jot down my number, send me an email, whatever works for you. So case study. So I have Julie presents to your office with her 15-year-old adopted son, Brady, due to behavioral concerns. Brady has been spending a significant amount of time in his room, declining to participate in family activities, and will sleep until noon or later almost daily. Julie has a close, loving relationship with Brady, and he will typically seek emotional support from her. However, there is significant conflict between Brady and his father, who struggles with alcohol abuse. Brady has always struggled academically, but in the past 6 months has refused to attend school altogether. In the past, Brady has participated in cheer and has had a lot of friends at school, but denies seeing them in some time. Lately, Brady has been leaving the house without telling his parents where he's going and has been gone overnight. It should be noted that Brady identifies as female and at times will sign papers with the name Brianna, but continues to use he, him pronouns and prefers to be called Brady. Julie speaks to Brady about this openly and is accepting of Brady's gender identity. Brady's father, John, says that he's accepting of Brady's gender identity, but at times will make comments of disappointment when he is intoxicated. Brady is also half African American and has expressed that at times, because of this, he has felt different from his family and community. Both parents work full-time jobs, but have substantial debt. Julie will at times pick up overtime shifts to keep up with the bills. John will frequently drink at various bars to avoid arguments with Julie. Both parents love Brady dearly and want to see him thrive once again. So what are the risk factors?
Not accepting of gender identification.
Yep.
And family history of active substance abuse.
Yeah.
Some limited monitoring.
Yep. But implied tolerance of substance use, right? Lacking pro-social activities.
Potential mental health concerns, just with that change in behavior and all of the time spent in the room, change in engagement with the family.
Yep, absolutely.
Well, and would you list the socioeconomic factors? Because that's probably resulting in the limited monitoring and supervision.
Yeah, absolutely. The high family stress due to finances. This isn't necessarily one we've touched on, but that feeling of belonging, right? Kind of he's feeling that he's different from his family and his friends, right?
I wonder if he's just leaving and he's going away, staying at friends, being gone overnight, maybe affiliation with friends who might be using or they're not aware of the family.
Yep. Great. Those are fantastic. And just for the sake of time, any protective factors that we can kind of rattle off?
Relationship that he's historically and I think currently still has with mom.
Yep, absolutely. His parents want to see him do well, right? Dad struggles with alcohol abuse, but dad also really loves and cares about him, right?
Parent stated disapproval of any substance use.
Yep. Pro-social activities, right? So I always find like if a kid has if they've in the past participated in a pro-social activity, right? But we'll just for the sake of time, we'll kind of move on. But based on what you're seeing from this youth,
likely.
Yeah. Anyway.
Is it a child that you would do a screener on in the clinic setting?
Yeah. And, again, this is somebody I would refer for an evaluation, right? So going and meeting with an addiction counselor, he and a parent, right? And this youth was using marijuana at the time, marijuana and occasional alcohol use. And so we actually did a lot of family-based intervention with this youth, and which was very successful, and also kind of helped connect dad to some various treatment options as well. Sometimes that's what you end up having to do too, is referring parents for some treatment as well.